Welcome to the Shared Practices podcast. This is season 4, where we're focusing on case acceptance. One frustrating thing when dealing with labs is waiting on a case and not knowing where stuff is. You or one of your team members has to call in, have the patient's info, you get a hold of the person, they go track it. It takes a while. It's inconvenient. Lab Pronto with Blue Sky Bio has introduced a solution that I hope we can get industry-wide for dental labs. And what they do is once you've submitted your case, they notify the dentist via email and text throughout the process as the order is being fulfilled. So step 1, you place the order. Step 2, they receive it. They send it to a network of top-tier labs with relevant knowledge and experience. Step 3, the lab with immediate available time claims the job, prepares the relevant parts or digital plan. And then step 4, the lab completes the order and returns the part or dental service to the dentist. So what do they offer right now? Orthodontic services, including orthodontic plans, model printing, and aligner fabrication. Surgical guide services, including treatment planning and surgical guide fabrication. In the future, we're looking at things like denture design and fabrication, crown and bridge, radiology report. It's pretty exciting. Lab Pronto is changing the way we interact with our labs. Lab Pronto from Blue Sky Bio. Awesome. We have with us today Dr. Chris Salierno, who is the editor of Dental Economics. And we've had Dr. Salierno on the show before when we were talking about associate deciding when it's time to go and move on and when you're really getting more benefit out of your current associateship. So we'll have a link in the show notes for that episode. That was a really awesome episode back in season 1. I can't believe it's almost been 2 years. So welcome back to the show. Thank you for being here.
Thanks, man. Thanks for having me back.
People really like that. And I've actually had people like within the last month or two still reference that episode to someone else who was like, oh yeah, talking about associateships. They're like, yeah, go back and listen to this one. So I really, really appreciated that.
Cool. That's awesome. We are very valuable. And sometimes I think as associates, we think, oh, I can't do this by myself. And I'll never find a job. I'll never eat again.
Yeah.
And that's, of course, we can't. We got to stand up for ourselves.
No, for sure. Well, now we've taken a lot of our listeners who were associates maybe 2 years ago, and they're now practice owners because we did a whole season on acquisitions. We did one on startups. And now we're delving into case acceptance, which is awesome because you guys at Dental Economics did a whole issue of your magazine in March on case acceptance. Why was this something that you felt so important that you dedicated a whole issue to it? Because I'm on the same page with you, but I want to hear your logic behind doing this as a magazine.
Yeah, I'm sure I did it for the same reasons that you dedicated a whole season of your podcast to, right? So it's continually an issue for dentists. What's really funny is I love looking at key performance indicators and measuring the different success parameters in a practice. And this is probably one that is the most mysterious. If you ask most dentists, what's your case acceptance rate? They're going to be like, 95%. I'm killing it. Right. And they really have no idea.
Yeah.
They have no clue. And to be honest with you, having studied this extensively, I don't even have a great answer for you how you can determine what your actual number case acceptance is. Like there's not a Dentrix or EagleSoft report that really gives you a true answer, in my humble opinion.
So we start off with this like fuzziness to it from the beginning. Yeah. It's naturally kind of a hard to measure thing because you can define it so many ways. Is that what you're saying?
Well, yes. And I think, look, from a gut reaction standpoint, it's very rare that when I'm presenting treatment to someone, whether I'm sitting down in a separate consultation room and it's a whole big case, or whether I'm just pitching them something while they're in the hygiene chair, it's very rare that person looks at us in the eye and says, no. You know what I mean?
Oh, yeah.
Like, it doesn't really happen. They're like, oh, okay, that sounds great. And then they just never schedule the appointment. Or they do and they no-show and then we never see them again.
Right.
So it's so easy by nature for what we're measuring here for this to just totally get lost in the shuffle.
Okay. Well, and it's everyone, it's just like driving ability. It's like anything else. Like we assume that we're doing pretty good. Like everyone has to be above average. Like I assume I'm above average. So, like everyone else is going to assume that same thing. So I bet it's pretty rare that a dentist truly acknowledges like, this is where I suck and I need to get better. And even those of us who think we're doing pretty good probably could be doing a whole lot better.
Yeah, for sure. Exactly. And I think you will always do well for yourself if you look to improve your case acceptance. And there's a whole host of ways that we can talk specifically about doing that. But it's just never a bad idea to excel at case acceptance. Because what that ultimately is, if you think about it, is you are creating a wonderful experience for your patient. You are informing them, you're communicating with them successfully. Hey, you have these problems. They're just so dazzled by your grandeur and your team that they're like, yes, of course I'll get this treatment done. All of those things have to kind of fall into place. And so if you're doing case acceptance right, you're doing a whole lot of other things right for your practice.
Yeah. No, and I love that point because we had to decide, what season where we're going to do of the podcast next. And like in my mind, I was like, well, we could do marketing, we could do this, that, the other, we could do, leadership and teamwork and all these things. But with case acceptance, if you're focusing on case acceptance, you're going to understand marketing better, and you're going to be marketing to build trust so that patients come in the right way, and you're going to have systems that lead to case acceptance. So it's kind of like one of those, if you're focusing on this, it helps you tease out some of the important variables on everything else and really improve your systems all the way around.
I completely agree with what you just said. You phrased it very well. When people say, oh, your practice is suffering, you don't have a lot of new patients, well, what we should do is marketing. Well, maybe that might be part of the solution, but you actually might need to get a lot of other things in-house in order, right? Your systems, maybe you just have a terrible front desk person and they're annoying the hell out of everyone when they call, right? Yeah. So if you're just spending money and energy on marketing as a go-to right off the bat, well, you're rearranging deck chairs on the Titanic. This is not where you should be spending your time and money. Yeah. But if you really take a hard look at all of the elements that come in to a patient saying, yes, I trust you to do this work for me and I shall pay for it, then all of those elements, all of those systems that come into play, that's really where so many of our practices are missing the boat a little bit. They get lucky sometimes and they have patients who will just say yes because they're in pain or they're very motivated. But are they really firing on all cylinders? Are they really achieving everything that they possibly could? So I'm glad you're focusing a season on this. To a long answer to your question about why we did a theme issue on this, it's arguably the most important element of our practice is can we welcome people into our practice, tell them they need work, and have them say yes, do it.
Awesome. Okay, well, so I'm going to push back on you a little bit here because you've already said that this is a little bit nebulous. It's hard to measure. And in your editor's note, you talk about this, the idea that we want people measuring this and how you measure it isn't the most important thing. My question is, okay, but how would you measure it? Like you say, it's not the most important thing, but if I had to hold your feet to the fire, how would you, Dr. Chris Salierno, measure case acceptance?
Right. So as I was saying in my note, it's not so much important how you measure it, but that you do, and then you do it consistently over your period of time that you're going to be evaluating this. So I can absolutely get into fights with consultants right now.
Good.
About and they would be picking the fight, not me, about how they prefer that someone measure cases.
Okay.
Print your aging, unscheduled treatment report and just look at that number or whatever. But as we know, we can start to nitpick that and say, well, there are patients that, let's say we treatment plan 6 crowns and a few fillings on them, and they do whatever their insurance allows, right? So they're part of the crown a year club, as people sometimes like to refer to that, right? And that's fine. I would prefer that they got their treatment done all at once and for the best outcome. But, that's someone who would show up on your unscheduled treatment plan.
Okay.
Yeah, they don't have an appointment right now to get that crown done, but we're good. Like clockwork, they come in and get their crown done every year, and we're slowly but surely making their healthcare better. So
they're slowly accepting treatment.
So should that count as against me if I'm looking at my potential 100% of case acceptance? Is that a ding on my report card here? Is that someone that hasn't accepted treatment? Now, here's where we'll get into a fight.
Sure.
Because there are consultants that'll say, yes, you're not doing your job correctly unless every patient walks out of there getting all of the treatment done all the time. They need to do it immediately and take out loans or whatever they have to do to get that care done. And I would say, because I'm a little more practical, I would say, you know what? No. If someone's moving towards getting their work done, they may have their own financial pressures. They may just honestly not give that much of a crap about their oral health. They kind of give a crap about their oral health, right? And so when they come back into my practice and they still have red on the screen, as I like to say, they still have treatment plan work that I planned 6 months ago at their last recall visit or a year ago, and it's still there. That's honestly how I like to just give a gut armchair report to myself of, have I successfully communicated with this patient? Have I gained their trust? Is this person accepting the treatment plan?
Okay.
So that's my fuzzy answer. I'll give you a specific one. That's my fuzzy.
Perfect.
Is look at the red on the screen. And instead of trying to get this big overarching number, oh, I'm at 85% case acceptance. Oh gosh, I got to do something about it. Forget that. My specific answer is to look at each individual patient that has red on the screen, that has unscheduled work to be done, and figure out why they personally have decided to postpone that care. And it's not that they said no, it's just not yet in many cases, right? So figure out and actually talk to the darn person and figure out what you can do to help them overcome whatever their objections are.
Yeah.
Now, many times it's financial and it can be other things, and we can get into that. But that, to me, is how I measure case acceptance, is on a patient-by-patient basis. I have plenty of other key performance indicators that I look at for new patients per month and all this other stuff, accounts receivable. I sleep perfectly well at night, not actually knowing that I'm sitting with a big number over my head of 92% case acceptance. Because honestly, what does it even really mean? We should measure it in the sense that we should be paying attention to it. But honestly, if I printed up some magical report that told me that it's 5% case acceptance, I don't know what I would necessarily look to do as an overall strategy. What I would look to do is better communicate with my individual patients and figure out what their specific obstacles are to treatment.
So you're saying you're going to learn more on a patient by patient basis. How do I overcome, say that this patient had this, and this, that's what's stopping them from getting treatment. Maybe you're not going to convince that patient, but maybe you're learning from, okay, these are the kinds of things that keep my patients from saying yes. How can I get better at overcoming these objectives or making it easier for them or providing options for them?
Correct. I go right to the trenches and start talking to patients. And I do. Every time I see a patient, they come and call, they still have work. I say, hey, look, we have some, we still have some stuff on the to-do list is usually how I kind of like break the ice on that. Oh, I see we still have some stuff on the to-do list. Did you have any questions about that? Is maybe how I bring it up. But the whole time I'm reading their body language, right? There's no one canned speech in case acceptance that will get someone to say, oh, yes, sign me right up. And if anyone tells you there's a canned speech that works every time, they're lying.
Right.
It's just about personal skills. If they haven't had work done, I see it right on the screen. Hey, I see there's stuff on the to-do list. I'll do my exam. I'll then try to pay them a little positive, not necessarily a compliment, but I try to then to reopen this conversation about the work that's to be done in a positive way. So, for example, if there's nothing else now that needs to be done, if there's not another filling on top of the stuff that they have postponed, then I get to say something along the lines of, well, I'm happy to tell you there's nothing else to add to the to-do. I'll say something along those lines, right?
Turn it into a positive thing.
Yeah, that's my shtick. That's what works for me. And I'm not saying everyone else should do that, but I like to then keep it friendly, right? So they're like, oh, that's good to hear. Oh, that's a relief and all that kind of stuff. And now I'm going to talk to them about what specifically needed to be done, right? So is this where we treatment plan to filling because there's a cavity that's getting larger and larger? Well, I'm going to speak to that with a little more urgency than just, oh yeah, here's this tooth that, has a large amalgam filling, 5 surfaces, and we see some cracks. And, it'd be nice to be proactive and do a crown before it breaks. For me, those are 2 different urgencies. One's that it would be nice to do, and here is if you're proactive. And this other one is I would really urge you to do this sooner rather than later because there's disease in your mouth, right? Yeah. And so I should speak to those things differently, right? I shouldn't just say, hey, you have a filling and a crown that need to be done. We offer care credit. You should just get that, and we'll get you signed up. Okay, talk to the lady at the front. We'll get you an appointment.
Right.
I've completely missed the boat there.
Right.
I'm assuming that finances are the problem, and great to offer care credit. Care credit's awesome, but I've assumed that the finances are the reason that they have postponed care, and I'm lumping together something that, in my opinion, is more urgent and something that's more proactive and would be nice to do. So those kinds of rapport with patients, that kind of banter, I think is just missing the boat. I haven't connected to the patient. I haven't actually asked them anything about themselves or why they've decided to postpone treatment. I've just dismissed them. And those are the kinds of mistakes I think, unfortunately, a lot of us are making.
So how do we, so I love the way that you phrased, how you break the ice and say, we haven't added anything to the treatment plan. So how do you then kind of prod and get them to open up a little bit about, like what's keeping you from moving forward? Like what do you actually say in your Chris Salierno way? Maybe that's different than someone else is going to do it. But what's your opening question then next to get them to open up?
Yeah. So, and this is again very, very patient specific,
sure.
Right? So there's no one, as I just said, I'll stick to it.
Yeah,
there's no one canned speech that I use, right? So for me, I want to figure out, and this works. Okay, this is if I'm trying to convince a patient to get treatment done that they haven't already had done, or if this is a brand new treatment plan for a brand new patient.
Okay.
Right. What I run through, the algorithm I run through that I think might be helpful to your audience here, is I determine, is this a simple case or a complex case?
Okay.
Now, I don't just mean in terms of the dentistry. That's one of the factors. A simple case certainly has a basic treatment plan. It's a couple of fillings, right? It's whatever. If I have to pitch this person, okay, we could do a bridge here and a bridge here, or we could do an implant and one bridge over here. We also can do that. If there's a lot of moving parts, a lot of options, a lot of dentistry, then we're automatically in that complex arena.
Okay.
Right?
Okay.
The next qualification for a simple case. So a basic treatment plan, relatively simple, straightforward to understand. It also has to have a basic financial plan. Right? So this has to be relatively straightforward financially for someone to explain. And yeah, probably also relatively helpful if it's not big numbers, what big numbers mean to you in your community.
Sure.
Right?
Sure.
So if it's a basic treatment plan and a basic financial plan, we're on the right foot. We're still in the simple column. There's one more area here, and this is what you were asking about, is basic persuasion. I start to broach the conversation with this patient. I'm starting to lay out for them, of course, what I'm noticing, right? As I'm sure everyone knows, you talk about the disease that's present before you talk about your solutions,
right,
before you talk about treatment. So I'm laying this out there, and if I see the head nodding, oh yeah, oh gosh, I got to take care of that. Okay, we're in basic persuasion mode. What that means is we're now officially a simple case. We have simple treatment plan, a simple financial plan. The patient, I'm reading their body language. They're like, yeah, I'm on board. Well, okay, yeah, we can set up an appointment to do that, right? They're showing me all the right steps.
Sure.
This is now officially a simple treatment plan. This is a simple case presentation category. So I feel comfortable in this instance treatment planning them while they're sitting there in the hygiene chair or while they're sitting there in my chair or wherever we are. And then turning them over to my financial coordinator to go over the numbers. They sign the financial documents. They then can book an appointment and they come and see. But if any one of those factors is not met, we are now in the complex arena. So it could be a simple treatment plan. It could be like 2 fillings. It could be a very simple financial plan.
But it's not a simple patient.
And the patient's like, 2 fillings. What do I need, doc? No big deal. I'll wait till it hurts. Well, now we're in a complex case. I don't care that it's easy numbers. I don't care that it's easy dentistry and something.
Interesting.
So anytime I have a complex case for any one of those reasons, right? All 3 of those things have to be met for it to be simple. If any one of them isn't met, then it's automatically complex.
Okay.
Right? If it's complex, I do have I don't want to call it a canned speech. It's not. But I have I'll give you some of the verbiage I would use to start.
An outline, quote unquote. Like an outline, like it's not, you're gonna deviate. And it's gonna be flexible.
That's right. It's gonna be flexible, and it changes based upon what I see the patient reacting to. But I'll say things along these lines, right? And so I may have someone that persuasion-wise, by the way, is totally on board. They're like, oh my gosh, I don't know what to do. But I'm thinking to myself, geez, I don't know what to present to them, right? This is a complex treatment plan, right? I need to mount models and look at all the financial options. Do I do a denture or an over-denture with implant? All of this is complex. So here's what I said. I say, listen, we're at a crossroads right now. We're at a crossroads for your oral health. I want us to take some time. I got a lot of great information today. I got x-rays. We got some photos. It's time for me to go do some homework. what I'd like to do is to bring you back in a week for a half hour. Now, there's no charge for this consultation. I never charge my patients to discuss their well-being with them. Let's come back for a half hour in a week and just talk. I want to go over the different options that we have here. I want to make sure you feel real comfortable, that you have all the questions you can possibly have answered. And we'll just start to make some headway on where we're going to go together.
So that's it. So that's
it.
That's
what I say. I say something along those lines. And then I shut the heck up and I just smile and nod and look at them. And I'll tell you something, patients don't say no to that.
Really? Because
it's a half hour consultation for free, no charge. Yeah, all right. Yeah, I know there's a lot going on now. All right, let me hear what this guy's got to say.
Interesting. Because I would my default is to think that people would be like, well, I'm busy, or just tell it to me now, doc. How much of that do you get of they don't want to come back for that?
I don't get it.
Wow. Okay.
I'm being perfectly honest with you. I don't get it. Now, I'm sure over the years, they rarely say no to your face, right? Has someone said yes to the consultation and then no-showed and then we couldn't track them down?
Of course, yeah.
Yeah, I'm sure that's happened a couple of times. But then those are patients who just want to come in, get a cleaning, and be told everything's okay.
Right.
And honestly, at that point, if it's really severe dentistry that's needed and they're just blowing off from a consultation, I've got a real big problem.
Yeah.
Especially, if they're no-showing on that, that's a whole other avenue we're pursuing. Right?
Totally.
So, yes, even if this was a tooth-filling case with two little minor cavities that are just incidental and the patient's like, nah, I don't need it. Yeah, I'll still set them up for a consultation. I don't normally have to get to this point. We're talking about rare cases.
Right.
But I would still absolutely do that. And I still absolutely have done that because I need to get to learn more about this patient. I need to understand who they are, where they're coming from. And honestly, if we're going to be a good fit for each other.
Right.
Because there's all kinds of reasons people can delay treatment, and some of them are very legitimate. And I want to be sensitive to those reasons and see if I can help them overcome those obstacles. And we know what they are. It's fear, anxiety, just dental phobia or whatever, or it's financial is arguably the biggest one. And those are, in my opinion, legitimate reasons. If their reason is because they just don't care, then maybe we're not going to be able to dance together.
Right. So I love this, and I haven't heard anyone kind of bake this into a system like this. This is really good, and I have some questions. Like, when you are normally doing your exams, I'm assuming you're kind of bouncing back between exams and treatment and checking hygiene. Do you set these up at a time in your schedule where you're not involved in other treatment?
Yes, it's a great question. It is a dedicated half hour, as if it's booked in my column in my schedule, and preferably it's done in a consultation room. I have a dedicated space just for consultation.
Do you tend to do these all on a certain day or like the end of the day?
No.
Okay, you can do it
as they come up. Honestly, it's not every day that I see patients who have full mouth rehabs that need to be done.
Right.
And it's not every day that I see these complex cases. So half hour consultation, it's booked in my chair, so to speak, but it's done in the consultation room.
Okay.
It's uninterrupted time.
Okay, cool.
And I'll say too, by the way, real quick, that I have empowered my front office team to know that if they get that new patient call where they're like, how much for this? How much for that? Is your doctor use clean instruments?
Right.
And all those kinds of wacky questions we get. It's like, dude, we haven't even met. How am I supposed to quote you over the phone?
Right.
Any kinds of odd new patient interaction questions that we're getting, they're empowered to say, you know what, it sounds like you have a lot of questions and we want to make sure we answer them. Of course, it's really hard to do that over the phone. I tell you what, why don't we have you come in and meet Dr. Salierno, and we'll spend just a half hour of his time. There's absolutely no charge for this. And he can go over, address these questions. We can give you a tour of the office and just make sure that we're going to be the right office for you.
That's awesome. So you've kind of given them the ability to trigger this is a little bit more not needy, but just patient who has more concerns, and they can totally do that. But I need to pause real quick because I think I've been pronouncing your name wrong the whole time because I just heard you say it. So it's Salierno, not Salierno.
You see, you're pronouncing it the correct way. See, you're doing it the traditional, Salierno. You're saying it with the music. That's beautiful. I appreciate it.
Okay.
I've Americanized it since.
Okay.
Yeah.
Fair enough. Okay. And that's good. I mean, because Scott Luna, everyone calls him Loon, because they don't know there's an E on the end of that you pronounce.
Yeah.
So Okay, Chris Salierno. I can't even do it because the I's there, and I want.
No, do it your way. Your way is completely correct.
Okay. Well, we'll let our listeners choose if they ever run into you. Okay, so you have this system both for yourself and for your front desk to allow yourself to create space and time to resolve these concerns, to really get to know the patient, to figure out what it is that's keeping them back or that is going to be a roadblock to them accepting treatment.
I love how you phrased that. I love that you called it to create space and time. That's exactly what it is. Whether it's a new patient on the phone or a patient who comes in and they just still haven't been accepting treatment or whatever it is, dentists, for some reason, we all just feel this urgency to hurry up and treatment plan, hurry up and get them in, close the case, get them in, get that production done. And I say that's a bunch of baloney. Let's create space and time for the patients that need it so we can very calmly, without any distractions, just get back to connecting with people, figure out what motivates them and figure out what their obstacles to treatment are.
Okay, cool. So one of the challenges that we're asking you to take on in this season is to think about your practice from the perspective of a patient. So to go through the patient experience of how they're checked in, treated, checked out, and part of that is impacted by the physical layout of your office. Whether you realize that the layout of the office that you're in is less than perfect, or you're doing a startup and want to have the best layout and don't know where to start, Design Ergonomics is here to help. We've partnered with Design Ergonomics because they've been doing this for 20 years, and they know exactly how to create office floor plans that flow, make sense, and feel natural to your patients. And unlike maybe some of the free floor plans that you'll get from suppliers, these are going to maximize your square footage and are not just designed to get you to spend more with that supply company. The first thing that they do is called a blocking diagram, which is basically just a conceptual outline of your practice without all the little nitty-gritty details. That way, you don't end up with a high-end consult room sandwiched in between a compressor, an autoclave, and the bathroom. You laugh, but sometimes this happens. It's super easy. Their team can remotely evaluate your layout and walk you through your design to make sure you're maximizing productivity and allowing for future growth. To help you get started today, Design Ergonomics is providing a special offer to Shared Practices listeners. If you go to www.desergo.com and enter the promo code DESIGN today, it's 2 separate words, you get $500 off. That's right, $500 off their already specially priced blocking diagram and floor plan bundle. This discount is limited time only, and it's only for Shared Practices listeners. Go to www.desergo.com, promo code DESIGN today for $500 off your blocking diagram and floor plan bundle. What do you do between seeing them the first time and this return visit, if anything? And if you don't do anything, then what do you do when they get there? What's the format for this? I know it's kind of formatless, by definition, you're trying to explore their needs, but is there anything you do in the interim?
Yeah, so there is a little flow to this. There's some structure to this. So if it's a complex treatment plan, then you know what I'm doing. I'm mounting the models, I'm studying the x-rays, I'm getting out my scratch paper and working up a couple of different options and plans. Yeah. If it's a financial one, which often goes hand in hand with the complex clinical stuff, if it's a financial issue, then my office manager or whomever can start to get some information from their insurance. We're not submitting pre-Ds at this point. This is a 1-week turnaround time. No insurance company is going to get back to me in that shortest time.
Right.
And honestly, we don't know what the plan is in a lot of these cases.
Right.
So, we're just feeling each other out here, right? If it's a persuasion issue, then there's not much I do prep work in between the two visits.
Okay.
Yeah, it's more just setting the stage for when they do ultimately walk in. Okay,
cool. So then they walk in. Is there anything differently that you do about this visit, like when they show up to the office or when they come back? How do you set this visit up and how do you start this visit?
Patient walks into the consultation room. They're seated, and sitting in front of them are their radiographs on the screen.
Okay.
Models, if we've taken them, clinical photographs on the side. All of that information is sitting there, and I want them to just stare at it for a couple of minutes. Now, I'm not manipulating them. It's just I want them to come face to face with
their teeth,
with what we're seeing, right? And that's the technique you use in the hygiene chair too, right? You take intraoral cameras, you leave it up there while the hygienist goes to get the dentist. Yep. That's good to do. You're not manipulating anyone. You're just putting it in their face. Hey, this is what's going on in that hole that you never look inside.
Right.
So that's been sitting there for him. I walk in, exchange pleasantries, and now this is something I'm very excited to share with you. This is something that I have done for years and years, and it absolutely has helped me a great deal.
Cool.
I sit down and I do not start just reviewing. So as we discussed last time, you see here, there's decay, and over here, there's decay. Oh, blah, 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 blah. I don't do any of that.
Okay.
I sit down, I look at the screen, I gesture towards the screen where there's clearly a problem going on or whatever, tooth about to fall out, whatever. And I just say this, tell me a story. That's it.
That's it?
And I don't say anything.
You don't say, tell me a story about, you just say, tell me a story?
No, I'm pointing at their teeth. I'm like, all right, tell me a story.
Okay, so...
And what comes out of that patient's mouth next is fascinating and just endlessly useful.
Huh.
If I'm pointing to a tooth that is barely hanging in this person's head, and I say, and we've already talked at at their hygiene new patient visit, I've already said, hey, I'm concerned about this tooth. It's pretty loose, right? Yeah, okay. So we've already said all that, right?
Yeah.
I'm pointing at this tooth, and I say, tell me a story. They might say to me, yeah, doc, I don't know, my tooth don't work so good anymore. Anyway, can't we just throw some spackle on there? I got to get out of here soon. If that's what they say to me next, I have a very clear idea now about what I need to do to motivate this person to help them understand the dilemma that their mouth is in, right? That's where my words are going to be going.
Right.
If I might also, though, have someone that looks at that tooth that understands the dilemma. They understand you can't just throw some spackle on there or whatever. They care, but they might say, oh, I know, I'm just so mortified about this. It's terrible. Honestly, I've been to other dentists before, and I'm just so concerned. Everyone's been giving me $8,000 to $15,000 treatment plan. Great. If that's what they say in response to tell me a story, now I know they understand. I don't have to spend time being it's bad that your tooth is going to fall out. They get that, right? What I'm now going to work on them with is what did they tell me? They told me that their big obstacle is finances.
Right.
Great. Now let me work on that. And let's start there. I'm not talking about teeth. I'm searching for what motivates them and what obstacles might be there. Right? I just want to listen to that and then use that and communicate to them with those motivations and those obstacles. An example of a motivation, I gave some obstacles, but an example of motivation is I might point to that tooth and say, and they might say, yeah, that's embarrassing. Honestly, I'm up in front of clients all day. I'm sure you've had patients that say stuff like this. I'm in sales, I'm in front of clients all day.
Yeah.
And I'm just really worried if I take that, I know that tooth's barely hanging on, but if I take it out, I can't walk around with just nothing for a while. I can't do it.
Right.
Well, they've just told me what motivates them. They gave me a little bit of an obstacle. They told me the fear of walking around and being awkward with their clients, but they've also given me a really important motivation too, right? The cosmetics is important in their line of work.
Yeah.
This is all great material. This is all fertile ground for me to now talk to them on their level.
So you've basically turned it over to them and said, I mean, that one phrase is just kind of let's just open a can of worms. Just tell me what is it that's in there that, is motivating you, that is concerning you. And, but you just say it so simply, tell me a story. And they just divulge where their mind is in relation to this piece of dentistry, in relation to their mouth, in relation to finances.
Yeah.
And that listening component, you can then turn around and really have a productive conversation rather than assuming and having a very unproductive conversation.
Yeah. People say to me, what do I say to a patient? What do I say? Don't say anything. Listen to them. Yeah. Use lead generating questions. I like to say, tell me a story. You can also say, so tell me a little bit about your history and your dental history, or tell me, where do you want to be in 5 years, or whatever you want to ask.
I like tell me a story because it's just so open-ended.
So open-ended.
And so non-assuming, it's let's have a conversation about your dental health. There's just so much baggage to that. Whereas tell me a story is just okay, let's just be humans for a minute. Just share with me what's going on. I just want to know,
I've had people tell me beautiful, heartbreaking things. They'll tell me, my God, I put my children first for the past, 30 years, and I'm so ashamed to smile. I can't enjoy my food anymore. And you know what? you know what? It's time for me now. I'm ready to make a difference for myself now.
Yeah.
And my God, like I'll start tearing up in the chair right there. I will do anything and bend over backwards to get this person, to where we need to go. But you only find these things out when you shut the heck up and don't just start blabbing dental speak at people, and you actually just listen to them.
That's awesome. So what else? You open this up really open-endedly. Is there anything else that you want to try and make sure you do during this visit other than listen, address the concerns and objectives and motivations that they bring up? Is there anything else that you try and like make sure you fit into this visit?
Yeah. So this is, as I call it, it's a 30-minute deliberate, comfortable dialogue. It's a dialogue. We're going back and forth and talking. I'm not just hitting them over the head with my dental knowledge. It's comfortable in the sense that we're sitting in a consultation room, hopefully, if that's options available to you.
Yeah.
It's deliberate because we're not just shooting the breeze here. After some pleasantries in the beginning, I am moving this forward towards decision making.
Yeah.
And then it's 30 minutes. Again, 30. If you have an hour in your schedule, don't take the hour. Cut it off at 30 minutes.
Right.
People get bored. Their eyes fog over. Like, I will happily just reschedule them for a second 30-minute consultation. And at the end, I'll say, hey, we made some really great progress. This is rare that this happens, by the way.
Right.
But if we've discussed a lot of options or still not sure, I say, hey, we made some really great progress today. We eliminated some of the options that we were talking about. We're moving forward. I'd love to bring you back in another week or so for another half-hour consultation just like this. And you know what might be great, too? You've had a lot of great questions. Maybe you want to bring a loved one, a special friend or significant other. Another set of eyes and ears might help you make that, help us arrive to a decision. Now, that's nice for a couple of reasons. One, if I'll use that if I really sense the person's like, oh, me, oh, my, I don't know what to do. That can just be a good positive force there. But also, it's free marketing, right? It's like, yeah, bring this person in, help them see what, a nice office we have.
You've got a nice office. You're like the super nice, like caring person who actually wants to hear and help them out. And so they get to see almost you at your best when you're doing one of these consults.
That's right. That's right. So then that's the other part I would tell you. The final aspect of this. So as you learn what motivates and what obstacles are, whenever someone gives you an obstacle and says, oh, that's too expensive, or oh, that's going to hurt, or whatever, that's when you can start to use that framework that I wrote about in the March issue of Dental Economics about improving case acceptance, right? So there's this, that's just a little thing that I like to use. It's a nice little regimen to work through an objection when it's presented to you without just babbling, on and on and on, and making sure you're actually listening to what they say, right? So if it follows 4 parts, as I say. The first is acknowledge, to just restate to the person the objection they just gave you. You're letting that person know, I heard that you just said this is too expensive, and I want you to know that I heard it, and now we'll move on. Then,
so I want to you could do this one wrong and you can do this right. So I remember when my dad, I think, what is it? Does Seven Habits talk about active listening? There's like some, classic self-help books that talk about active listening. And I remember when my dad read this and he would like use this on me because he's a master's of organizational behavior. He does like leadership training. He's just as much of a self-help junkie as I am. And like he would repeat back to me like what I had said to him. I'm like, Dad, you're just saying what I just said. Like, he was doing it in a way that he's like, oh, so you're saying this, this, and this. I'm like, yeah, I just told you that.
Right.
So I feel like one of the best ways to do this is to say, okay, I just want to make sure I understand. You're saying this and this and this. And that gives the patient to say like, yes, you got it.
Yeah.
Versus
that's exactly right.
Authoritatively saying, so you're saying this and this. And the patient's like, well, no, that's not what I'm saying. It's more like, okay, is this what you're saying then? I just want to make sure I understand. And then,
yeah, that's a great point. You want to use it in one way too, just to clarify. Like maybe the person is rambling. Maybe they're the ones that are doing the rambling, and you're like, so what I'm hearing is you're concerned about finances. What I'm hearing, it sounds like you're concerned that this may not end up looking very good, whatever it is. So it's a good opportunity to clarify. But for me, I almost use it as a throwaway line. I'll actually just say, it sounds like you're concerned about finances, and then I immediately go into the next statement.
Cool.
I'm just giving them that quick, it's almost a throwaway line. So the second one,
it's a nice little transition. Like, it's just like a nice, like, I'm on the same page as you. We're on the same team. I'm not like arguing with your objective. It's like, oh, okay, so you're worried about this. And then you move on to your next thing.
Right. Or you might even be, again, for the finances one, it says, oh, this is just really expensive or whatever. I could say, yeah, we have a lot of patients that are worried about finances. You're not in this boat all alone. You're just letting them know they're in good company. I heard what you're saying. That's just a nice way to open up having some discourse, because the whole objective here is for me to change their mind. They just basically said, no, it's too expensive, or no, I'm afraid it's going to hurt, or no, I'm afraid it won't look good, or whatever it is.
Right.
That's essentially what they're saying. And my job in as short a time as possible is to say no and have them now agree with me.
Right,
so
right.
Here's how I go about it, right? So acknowledging what they said is a nice, friendly way to start it off. Then I state my objective. I want it to be abundantly clear what I want them to do, so there's no misunderstanding. I'll be very clear about what I want them to do. We should take care of this filling, sooner rather than later, or whatever. I then, and this is the magical part, I have to present my argument. I have to present my reason, not get into an argument with them, present my reason for why I want them to do it. And then finally, I give my conclusion. I basically just restate my objective. I want you to do this filling. I just restate it with a kind of a rallying cry. Now, so acknowledge, state objective, present argument, and then give your conclusion.
Okay, let me see if I can do it real quick without looking, because I have it on the left. So you said acknowledge, state objective. You're gonna turn it into argument. Crap. Present argument and then conclusion. Yeah. I cheated.
No, you got it. Absolutely. And you get bonus points. The most effective argument you possibly can present is if you turn their objection on itself.
Okay.
Right. So, and if for example, so the example I always give is someone says, $20 for a copay for a filling, that's so expensive.
Right.
So I say, sounds like you're concerned about finances. And I'm going to pause as you hear me go to each section. Right?
Okay.
I don't really pause here when I'm actually talking.
There's not a long dramatic pause in between each of these steps in your real conversations. Sorry.
Right. I'm pausing so you can see I'm going to the next one.
Okay.
Sounds like you're concerned about finances. I'd love to find a way for us to make this care affordable, because it's really important that we take care of it sooner rather than later.
Okay, so that's state objective. That's what you want.
Correct.
Okay.
I've been very clear. And I get some bonus points there too, because I'm kind of working their objection into, let's find a way to make that affordable for you. Right? Okay. Now my argument. Okay, here's where the magic happens. Right now, to get you back to health, it's only a $20 investment on your part. Unfortunately, the longer we wait, it only becomes more expensive to get you back to health.
Right. Okay, so that's where their concern was finances. You're saying, yes, we're financially doing this in your best interest.
Yeah, you think $20 is a lot. Wait till you have to pay for endo post-core crown, man.
Right.
Right?
Oh, yeah.
And that's true.
It is true.
I'm telling the truth.
You know how awesome is dentistry that we have a series of more expensive things the longer the patients go along?
Yeah. Fortunately, I guess you could say disease progresses. It tends to not just get better on its own.
Right.
Right. And then finally, my conclusion would just be so let's find that way to make this care affordable so we can take care of it while it's still only a $20 impact on your wallet or something like that. Right. So I'm just taking that same state objective. I'm just giving it hey, so let's do it, buddy.
Yeah.
And that's how you move through it. Now, I would be wrong, I think, if someone said $20 copay for a filling, that's a lot of money. I would be wrong if I said, sounds like you're concerned about finances. Let's take care of this sooner rather than later.
Right.
I promise it's not going to hurt. We use modern techniques and it's really going to be very comfortable for you. So why don't we take care of that filling as soon as we can? I've missed the boat.
Right.
Who said anything about this hurting? Right. I'm the one that all of a sudden introduced pain. What? The patient didn't say pain. Why am I bringing up pain?
Totally. Don't
introduce an objection that wasn't there. A, and B, that's not what the patient's objection was. You haven't successfully countered their argument.
I love that this is a framework and a system so that we can process this and build it into a routine of just every time patient comes out with something that's you can tell this is preventing them from moving forward. Acknowledge, state objective, present argument, conclusion. It's just and at this point, I bet you had to backwards engineer, what am I actually doing, and break it down into 4 steps. And now that's part of just, you've always been doing that. But I love that you've got 4 specific steps.
It helps us keep on time too.
Sure.
A good response to an objection, it's 30 seconds or something, right? Maybe a minute tops.
Right.
But when I've seen it, I've been in the rooms, heck, I've done it myself. When someone says, no, that's too expensive, or no this or no that, that we just start rambling. Well, your teeth are important, and bacteria is bad. And we just start rambling.
Yeah.
We're so insulted that someone would tell us no. We get emotional about it, or we just
get judgy or condescending, or,
Yeah.
My one of my co-resident friends that just graduated this last year with me went out and was presenting treatment to a patient. It was an Army patient, so they don't have to pay for it, but had kind of agreed with the patient, like, okay, this crown had come back. It wasn't the perfect shade. It was a posterior zirconia. It was like, okay, we're still going to seed it. And then the dental assistant brought up, like, well, no, like, it's really, really bright, doc, like, as he's going to seed it. And he had a conversation with her afterwards. He's like, well, like, when we're presenting treatment to patients, like, we want them to do what we want them to do without them feeling manipulated. And she was just kind of like shocked and appalled, like, wait, you're trying to get people to do what you want without feeling like you got them to do what you want? Well, yeah, when it's in their best interest. Like, that's like the thing that we have going for us, is that, like you said a minute ago, we're not resolving these concerns because it's just like selling some car that people don't need. It's like, it's their healthcare. It's their dental health that we're trying to help them take care of.
I agree with you. I like to think of this more as persuasion than manipulation.
No,
right?
Totally.
For me, manipulation is more like, my intention is I have to make my payment on my BMW this month. So that's why you need this crown, right? And we all can think of those unethical dentists that will recommend treatment that isn't really necessary.
Sure.
And in that case, you could use the same techniques I just went through, but in that case, it's manipulation.
Yeah.
Because it's not really care that the person really needs. We're in that gray area, and you're not being as forthright with the patient as possible.
The intent, I feel like, matters on a couple levels. One, just what you're doing. But then two, I think patients really do sense when you are in their best interest and when you are kind of pushing like a little bit. And that sense of being pushed is like one of the ickiest feelings. And I think a reason that people don't want to get better at case acceptance, because they assume that's what they're going to have to do. Is they are going to have to
sales techniques.
They're going to have to manipulate. They are going to have to push. They are going to have to
bait and switch, upselling. No, and that's all gross sales behavior. And by the way, I'm not against sales. A great salesman, we all have salesmen that come to our offices. There are wonderful sales folks that come to our office. Sales isn't gross and icky in and of itself. But I think because we're talking about healthcare, we definitely get like a little queasy about talking about using some of these techniques. I think as long as the technique is being done with the best of intentions, and that you're just trying to communicate clearly with patients about what their needs are, then you're good. I would say personally, and I don't know if this is totally the lesson of the story you were sharing, but if a dentist was manipulating, was deceiving someone and said, hey, the ends justify the means. Ultimately, they got the crown or the filling that they needed. Yeah, I had to sprinkle a little magic fairy dust on that and tell a white lie, but ultimately I did it for the right reasons because they got taken care of. I'd be like, yeah, but that's not the best way to do it. And when I'm talking to a kid to get care done, it's like, all right, the parents and I, they go in on a little white lie so we can treat this kid.
Right.
And that's fine. But we're talking to, by and large, adults who have the capacity to reason, and we shouldn't be manipulating them or anything that closely resembles it.
No, for sure. And I think that it was more of this doctor was just trying to help the assistant. Like, when we've reached something that like is in the patient's best interest and we're all on board, please do not throw out concerns after we've decided to move forward with treatment.
Sure, yeah. Yeah, right.
And there is, we are doing this a certain way. We want the patients to know and understand what we're doing, but we also really want to help them take care of these things. So it's like,
right.
Yeah, no, I think we're on the same page. So let's do another example. So you had a great example there with finances. Do you have another example? You've got a couple of cases in your article if people are interested there.
Yeah, I have a few there, but another example would be when someone is just afraid that the care is going to be painful. They just have anxiety. That's a very common thing in dentistry too, right? And this could be a very challenging thing to discover, because sometimes we do have patients that are very forthright and like, yes, I'm just so afraid to go to the dentist. I'm afraid. And they just are very honest. But sometimes you just have to really spend that time getting to know the patient, doing that tell me a story bit to uncover that, oh yeah, this is someone who's like had some trauma from in the past with dentistry or something, right? So when you're presenting to them now to have extractions and implants, for example, I mean, that's just like, oh my gosh, they couldn't handle fillings 20 years ago. Now extractions, and oh my God, you just sent them over the moon, right? So say, listen, you know, if you use all your gentle language as you're building up towards this, hey, you know, I think, as we know, we can't unfortunately save these teeth, but the good news is we can transition you into something that's going to be just fantastic. You're going to be smiling again. You're going to be chewing your food comfortably. It's going to be fantastic, right? So all that happy stuff, right? But then the patient says the objection. Oh, but I have to take out my teeth and implant. Oh my goodness. Oh my goodness. Right after that, you then go into that formula and you say, hey, I understand. You're really concerned about the dentistry that has to be done here, and I certainly understand your where that anxiety is coming from. We have a lot of patients like that. I would like us to move forward with this care in a very efficient way, but also in a way that's going to be at your comfort level.
Okay.
Moving on to part 3 here. You know, I actually have a whole host of patients that I've worked with and helped over the years that were in a similar position to you, sitting right there so many years ago. And they've actually agreed to be available to someone like yourself. You can pick up a phone and call them, and they'll walk you through the whole experience from their side. And I think when you get to talk to them and ask them all those questions that you have, you might feel that you're a lot more comfortable with moving forward. So if that sounds good to you, I'd be real happy before we take another step forward to get you in touch with some of my patients that I've helped. Right? So the argument turning it around on itself, you're afraid. Well, gee, I'm not going to tell you, don't be afraid, don't be a big baby. Like, that doesn't work. But a nice technique is, and that I've used for years, is you find your favorite patients that have gone through big transformations, and you say, you know, hey, is it okay if from time to time, maybe once a year, maybe not even ever, but if I can set someone up with you to just have a quick chat to help you walk them through it. I find patients are really very sweet.
That's awesome. How many times would you estimate that on a year or two that happens?
It's pretty rare. Usually the reason that people oftentimes if they're losing all of their teeth, by the time they actually come to see me, they know, right? I'm not the one that's telling them this for the first time. They're aware. And the fact that they picked up the phone and came into the appointment is showing that resolve. Yeah, they're kind of ready. So it's pretty rare that I've done it, I would say. I mean, it's not like, it may be a handful of times over the past few years, but for that is a real objection that needs to be uncovered for a lot of our patients, is that fear that it won't look good, fear that it'll hurt, fear that it'll break and fall out at the wrong time. So connecting to that patient works well. But then using that framework that I went through was a real efficient way to respect the patient's concerns, treat them with great respect and not be condescending, but then offer a really interesting solution.
That's awesome. Well, and I bet for some patients, just hearing that, like, I've had these other patients, I'm willing to, you know, you could talk with one of these and maybe they say no, but they feel like comforted almost that was an option. You know, it's like not everyone's going to take you up on that, but using that framework once again. Well, we had mentioned, maybe we'll have to have you back for another episode, or maybe you think we can talk about it quick here. You had mentioned the idea that one of the best ways to improve your case acceptance is to build systems for the type of patients that are coming into your office through marketing, through the way that you handle those patients and what procedures and what needs those patients have. Do you think that's something that would be another episode worthy in the future? Or do you think that's something that we could maybe do like a little 5-10 minute conversation about?
Yeah, it's definitely a full episode if I'm going to do it justice. But I'll give you the Cliff Notes version. I'll give you the teaser. Yeah, this goes back to just dentists having a business plan to begin with. This influences our marketing. It absolutely influences our case acceptance. The idea is that we dentists should stop trying to be everything to everyone. I will happily treat whoever walks through my door, but I have built my practice. Yes, my marketing materials, but also my entire infrastructure of my practice, my systems, all geared towards attracting and exciting particular target demographics. For example, the example I always give is busy business people. in my area where I practice, there's a lot of busy business people, senior vice presidents of this or that or whatever. There's a lot of major corporate centers in my town on Long Island. And I want to attract them. They need implants, they need cosmetic dentistry, whatever. But I build my practice towards what does that particular type of person want, right? They want to be seen on time. They want quick turnaround for appointments. They want evening hour appointments. You know, those kinds of things are what I should be building into my practice if I'm going to attract them.
They want the editor of dental economics. There you go.
Yeah, maybe that's what excites them. So you look at like 2, 3, 4 different target demographics that you really want to attract. And then you say, hey, to everyone else, I'll treat you, but I'm not going to build my practice towards attracting you, right? So if you walk into my waiting room, my reception areas, of course, we like to call it. If we walk into my reception area, there aren't like little toys and highlight magazines because kids aren't in my target demographics. I'll see kids, but that's not who I'm building my practice for. So once you start to go through this exercise of building a business plan, and I have some resources for doing that, then you start to get some really clear decisions about what your marketing should look like, how your team should fall into lockstep in terms of treating and taking care of patients, you know, what office hours you might keep. All of these things start to become very clear. And I'll tell you, you will have a much higher case acceptance if you are from first impression to last impression, welcoming the right type of person into your practice, giving them exactly what they're looking for, not just dentistry, but giving them an experience that they're looking for. I mean, you're absolutely going to have a much higher case acceptance. You're not just Joe dentist hanging up your shingle and treating everyone the same. Try to be not everything to everyone, but try to be something very special to some target group.
That's awesome because, you know, I realized I just finished this 2-year residency doing a little bit of everything. And I realized, like, I don't know why the light bulb finally turned on for me, whereas most people get this way before. I realized I will never be as efficient as any given specialist. Like, an endodontist has assistants, systems, equipment, like everything is geared to doing endo the most efficiently possible in the best way possible. And I can get better and do better endo, but it's never going to be perfectly efficient in the way that maybe they would do it. But you're saying this doesn't have to be like a specialty per se, but a type of person or a certain demographic, and niching down and kind of having a little subset. It's kind of like this podcast. We decided we wanted to focus on students and new grads and people who are looking to own and really focus on that. And I feel like that's one of the things that's allowed us to have great content, is because we know exactly who we're serving, and it informs our decision making. So making those same decisions at a practice level is going to affect all of your systems, your marketing, and your case acceptance by default, because you're building everything around this one type of person.
Right. So if you get an email from someone saying, hey, we're a pediatric dental company and we make really cool matrix bands for the kiddos, we'd love to have our CEO get interviewed on your show, your answer is probably going to be, well, thanks, but no thanks. That's not really our market. That's not exactly our format for our program. So you're not being everything to everyone. You're being something very significant to a targeted few. And I say few. It's not like
sure.
You know, it's still a large audience, but you're being very selective.
No, absolutely. I love that. I think that's great. And I think people don't do enough thought around that before, because it's hard to know in dental school, what kind of dentist do I want to be to what kind of people. But the sooner you can figure that out in your practice search, in your setting up your systems, and you can change a practice once you're in it and really aim everything at this one type of patient, the more successful you're going to be in that. Well, this has been fantastic. Absolutely. Thank you for coming back on the show. Thank you for putting out that episode. One of the things a quick question about dental economics, if we link to this, you know, I have the links in my email. Can anyone read dental economics? Is it free and open online?
Oh, yeah. It's open to the public. Absolutely. Yeah. Anyone can look at it.
Okay, cool. So we'll have links to both your specific articles within this issue, but also the entire issue from March. Thank you so much for being on the show. We really, really appreciate your input. And this was full of specifics. Yeah, I asked for in the pre-call, I was like, you know, the more specific we can get about like what you do and how you build this, the better. And you really delivered. So thank you.
Thanks, man. Thanks for having me back.
Cool. We'll talk with you later.